Passing the NCLEX, it's not just about what you know. It's really about what you do when everything's on the line. Today, we're going to break down those professional standards questions. Yep, the ones that really test your judgment, your ethics, and your ability to lead when the pressure is on. Let's dive in.
So let's talk about the professional standards trap. This is where so many smart, capable nursing students get tripped up. It covers the whole shebang: ethics, delegation, prioritization, and it's honestly where the exam separates the good test takers from the truly great registered nurses. But what makes it so tough?
In this quote right here, it hits the nail on the head. This gets to the absolute core of the problem. See, the NCLEX isn't asking you, hey, what needs to get done? It's asking, what needs to be done right this second to keep your patient alive? It's a total shift in how you need to think.
And here's the thing you've got to understand. You can't just memorize a bunch of rules for delegation or the principles of ethics and call it a day. It doesn't work like that. The exam is designed to throw you into these complex, messy scenarios where principles might even conflict with each other. It's testing the framework you use to make tough calls under pressure.
So that's the million-dollar question, right? How in the world do you build that internal decision-making engine that the NCLEX is looking for? How do you go from just knowing the information to actually applying it with that expert-level precision?
Okay, and that's exactly where the exam coach's framework comes into play. This isn't about cramming more and more facts into your brain, no. It's about systematically building the right clinical judgment skills, all rooted in cognitive science, so you can walk in there and confidently answer these really high-level questions.
So take a look at this. This is how we take a massive, overwhelming topic and break it down. Instead of some dense textbook chapter, you get a clear visual roadmap with these core pillars: ethics, legal safeguards, delegation, and all the way to prioritization. It's all about making this complex stuff way easier to digest and, most importantly, remember.
And we do this using our 3R learning method. It's simple. First, you review only the most important high-yield concepts, none of the fluff. Then we train you for recognition, so you can spot the key patterns the NCLEX uses over and over. And finally, you practice recall, so you can access all that knowledge instantly when the clock is ticking. All right, let's actually put this into practice with a real example. Prioritization is pretty much everything in nursing, right? So let's see how this framework helps you cut through all the noise and zero in on the one patient who needs you most.
Okay, here it is, a classic NCLEX scenario. You've got 4 patients. They all need your attention. Your brain is probably screaming, they're all important. But the NCLEX forces you to choose just one. So, where do you even start? How do you begin to break this down?
You start with the core principle. You have to anchor your thinking. For prioritization, it is always ABCs: airway, breathing, circulation. And here's the other golden rule. You must always deal with an actual life-threatening problem before you deal with the potential one. That is totally non-negotiable.
And this shows you the very next step. You start comparing your patients using that principle. So, Client 2 has active shortness of breath. That's a breathing and circulation problem happening right now. Now look at Client 4, absent bowel sounds. That's a serious potential problem for sure. Could be a bowel obstruction, but it's not an immediate threat to life compared to the person who literally can't breathe.
But look, that's just scratching the surface of the analysis, right? What about that post-op lung surgery client? Or the pre-op for the appendectomy? The full exam coach's breakdown walks you through step-by-step how to rank all 4 of these clients and explains the why behind every single decision.
See, this is what we mean when we talk about preparing strategically. It's so much more than just cranking through practice questions. It's about building a reliable, repeatable system for thinking that you can apply to any curveball the NCLEX decides to throw at you.
The whole exam coach's system is built to give you exactly what you need. We distill down the highest yield concepts, give you crystal clear clinical frameworks, and we even use techniques based on neuropsychology to boost your memory. It's really a complete system to build both your confidence and your competence.
So the final takeaway is this. The NCLEX is a beatable exam. It absolutely is. But you have to have the right strategy. It's time to stop guessing, stop panicking, and start using a confident, structured approach for every single question. And why does that matter? Because that's not just how you pass the exam, it's how you become a great nurse.